continued celebration of the grand opening of the new Mary Bird Perkins Cancer Center at TGMC. Today we are focusing on what patients should expect during their treatment at Mary Bird Perkins at TGMC. We have with us Julia Light, who is a patient navigator, to help us better understand her position and what educational materials, support services, and other resources are available for patients and their family members. Mary Bird Perkins Cancer Center at TGMC has everything patients need to help beat this disease. The Mary Bird Perkins Cancer Center at TGMC team, including the patient navigator, is dedicated to caring for our community and will be there every step of the way.
All right, welcome to Your Health with Terrebonne General Medical Center. I'm Martin False, and we are pleased to have on the set with us, and we will introduce her right now. There she is, Ms. Julia Light. She's an RN, patient nurse navigator, and we're talking about Mary Bird Perkins Cancer Center at Terrebonne General Medical Center. First of all, Julia, welcome to the program. Good to have you here.
Thank you. Thank you very much.
All right. Now, I understand that patient navigation is, I guess, an important part of cancer care today. Give me a little bit about your role as a patient navigator. What does that entail?
Well, patient navigation is a relatively new concept in cancer care across the nation and the world. Really what we talk about is the Freeman model is one of the models that we use in patient navigation. Dr. Freeman thought it was very important that all patients were able to access quality cancer care. And he has a continuum that starts with abnormal finding and goes through treatment into survivorship. So that's what we're really, trying to make sure that patients do have access to care. Also, I'm more like a care coach. I'm there to help the patients emotionally, financially, making sure that the barriers to care are eliminated for them. Through resources, I can refer patients to dietary, to rehab if they become weak. I can help patients with transportation, with financial help for medications, and also education. Education is very important for patients. When you get that diagnosis, it's very scary at first, and it can be very overwhelming, and patients can kind of get lost in that healthcare wave. So what I do is help educate them about their disease, their treatment options, and also, once treatment is finished, educate them on the things that they need to know about survivorship.
So navigator, truly navigator.
Truly navigator.
There you go. So you're following the title for sure. Now, of course, I just saw the facility. It's a grand facility. What can patients expect during the first visit at the new cancer center? Okay.
The first visit, they're going to meet with a financial counselor. And the reason for this is to make sure there aren't any surprises financially, and to also see, what help they might need so that we can be proactive with that. The next thing they'll do is they'll meet with the doctor, and the doctor will go over their records and assess their condition at that time. Also, they'll have a physical exam, and then the doctor will talk with them about their treatment options. Sometimes more testing is necessary at that time too, so they will be referred to maybe more x-rays, more CAT scans, maybe a PET scan. They may need to be referred to a specialist like a surgeon or a GI doctor at that point. And then after all that's taken care of, then they'll meet their treatment team, the chemotherapy nurses in the back in the beautiful infusion area.
All right, very good. Now, anything patients should know that they would bring with them?
Yes, they need to bring an insurance card, of course, and also if they have any cancer policies, they may want to bring those in too so that we can get the records for them. Also, they need to bring a photo ID, be it their driver's license or any other type of photo ID. They also need to bring a list of medications that they're on, or they might even, if they don't have a list, just bring all their pill bottles that they have with them. They also need to bring a list of doctors that are involved in their care. And also, they need to bring a list of any questions that they have. This is very important because once you get into that room and you're very nervous, you may forget the things that you want to ask the doctor. So write down every question that you have for the doctor.
So jot it all down.
Jot it all down.
Now, the clinical services that are available at Mary Bird Perkins at TGMC to patients, can you give me some of those?
Sure. Every patient's treatment is individualized, and every diagnosis that we have come through, it's very individualized. So we have things like PET scan, CAT scan, digital mammography. We also have, of course, chemotherapy, radiation therapy, and surgeons also at TGMC. And we also have different diagnostic imaging depending on your diagnosis too.
Okay. What we're going to do, we're going to take a break. Once again, Ms. Julia Light, an RN at the facility. We'll be back after a short break, and we'll talk more about some very important factors. So don't go away.
Terrebonne General and Mary Bird Perkins Cancer Center bring a new standard of high-quality, comprehensive cancer treatment to our community, now in one convenient location in Houma, bringing together world-class technology and a caring and healing environment to provide the best patient experience possible. Our new cancer center was built for you because we care for you. Mary Bird Perkins Cancer Center at TGMC, Houma.
All right, welcome back. Martin Foss here with Ms. Julia Light, an RN there. She is patient nurse navigator at Mary Bird Perkins at TGMC. And we've been talking about a lot of different things, but we're going to talk about the types of community-sponsored resources at TGMC. And I think we have some graphics to pull up, and you'll go through each one of them for us. There they are.
Yes, we do have Bosom Buddies. That's our support group for breast cancer survivors. That meets once a month on the fourth Wednesday of each month. We have Nosotros, which is a 10-step recovery support group for cancer patients and their families. That meets every third Monday of each month. We have Look Good, Feel Better. That's through American Cancer Society. It's makeovers with cosmetologists. They help with hair. It just makes the cancer patient feel better. Of course, that's for women. Camp Bluebird, which is going on this week at Lumen Christi Retreat Center, is a camp for adult cancer patients and survivors, and it's 3 days and 2 nights of recharge and reaffirmation of your hope. Also, TGMC has a wig room, which we're in the process of renaming and relocating. It's going to be called Beautiful You. Okay. So we provide scarves and turbans and wigs and prosthesis for patients.
Right. So how does MBP? I'm going to start calling MBP, Mary Bird Perkins. We're going to, for TV purposes, we like the MBP at TGMC. How do they educate the public, I guess, concerning cancer, and what are some of the things that y'all put out to the public to educate them?
We do participate in community-wide health fairs. We also have Speakers Bureau that speak at Rotary Club, at churches. Of course, we do HTV. Mm-hmm. We also have the Mary Bird Perkins early bird bus that goes out and does screening, and last year we reached 700 people with early screening with the early bird
and that's bus. Incredible. Mm-hmm. That's a great number. I was shocked to hear that somebody at the grand opening was talking about that, and that's encouraging numbers.
It is.
Not encouraging that people would have it, but it's encouraging that you find them pretty quickly. Now, the free cancer screenings that you all provide. Can you give me a list of those?
We do skin, we do oral, we do colorectal, we do breast, and we do prostate.
Okay. Now, a lot of questions that we always get on these screenings. How invasive are they?
Well, the skin is just a visual inspection of the skin. The oral is inspection of the mouth, the lips, the face, the neck. The early bird breast screening is clinical breast exam and mammography. The prostate exam is a PSA and a physical exam. And then the colorectal is a take-home kit, very easy to use, and then you just send it back to us.
Okay. Now, what happens if you go to a screening and they find something? What takes place?
Yeah, well, hopefully they don't find anything, but if they do, then you are contacted by a screening navigator from Baton Rouge, and then she makes sure that you get follow-up with the proper doctors and follows you through to where you are in treatment.
Okay. Now, notice that the MBP at TGMC grand opening, that there was this colorful butterfly, I guess we call it a mobile, in the lobby. Can you tell me about that symbolism and what's that all about?
Right. The butterfly is a symbol of hope for cancer patients. You know, if you know your biology, or you know that the worm goes into a cocoon, and before it goes into the cocoon, it doesn't really move around a lot. It feels very sluggish. It goes into the cocoon, and then once it's in the cocoon, it starts to emerge, and it emerges as a much stronger, more beautiful entity. And I think that for cancer patients, that's the symbolism of going through treatment and emerging on the other side with a better appreciation for life, and also a better outlook at life. You know, they're able to enjoy every single minute after their treatment.
That's a great story of hope.
Given hope. Yes.
That's very good. Now, for more information about Mary Bird Perkins Cancer Center at TGMC, who could they contact, or where could they go? Okay,
they need to contact marybirdperkins.org at //TGMC, or call 985-857-8093 or 985-876-9045.
All right, Julia, we appreciate you being on To Your Health today. Thank you so much for coming.
Thank you for having me.
All right, keep up the good work.
Thank you.
It's a great center.
Thank you.
All right, we're going to take a break. When we come back, more on Bayou Time, so don't go away.